Okay, so today we are going live. We're going live with a series for microsurgery upgrades. We teach you how to suture, we teach you how to do tendon repairs, such as do local flaps and skin cancer. But another part of this training is microsurgery. It's a challenging skill to upgrade yourself on. We've got several videos teaching you how to do this at home with a phone stand and a camera. Now we're going to do a challenge. Challenge is doing your microsurgery every week to upgrade your skills. So this is what we're going to do. We've got our simulated vessels. Here you can get them on medsyncltd.com/medshop. It's tagged in the description on the page. Get yours, get your MedSync microsurgery instruments. There's a 5-set. Really, really fine. Allows you to use as small as a 10 if you so desire, reliably. And then you can either use chicken thighs, which are a perfectly reasonable model. If you don't want to use meat, we have these simulated vessels. All you need to do is get a little board or do it on the table, put a little tape down. Training at home should be easy. And then you tape it in position. You make sure that you can see right there. And we're going to do some microsurgical skills. First, we need to put some music on in the background for ambiance, because it should be relaxing. So we're going to play a little playlist. And here's some questionable choices, but still some good music. All right. So let's get set up. Got our straight scissors here. And we're going to go for this tube right here. So this is a 3mm micro tube. And let's zoom in a little bit more. Let's zoom in, let's zoom in, let's zoom in. It's a pretty good view, I would say. Let's make it a bit more aesthetically pleasing. Right there. All right, so we've got our 3mm tube. I'm going to go with a 9.0. We're going to go live at least twice a week to see if we can improve on microsurgical skill. You can do it live with us. Probably going to be on weekends. Get your microsurgery instrument from medsyncltd.com/medshop. You can do it with a camera phone and a phone stand. We've got videos on microsurgery training for trainees. So this is our suture, taking it out directly under the microscope. Keep it in my surgical field. I've had plenty of coffee today, so we're just going to work with what we've got. This is a 9.0 suture, and we're going to do our epineural sutures. So we should probably start with our back wall first. There's not really an adventitial on these things. What I'm going to do, rather than do bad things to teach you, I'm going to teach you the right way. So flip it up. I'm not holding anything. My dilator's inside the lumen. I'm going in the back wall first. I've pushed it through. I've let go. I've pulled it through. This is a 9.0. It's going to be a lot of stitching. You can join us for that. I'm going to put this down. I'm going to put this suture somewhere where it's easy to grab, which is there. And then we need to do our other side. My field of vision is just this square because I'm quite zoomed in. I'm going to put the dilator in the lumen. Pick it up, go in between my forceps, and then boom. I'm going to put counter traction, hold it, and then pull. And then I'm going to pull. We need all this to be on the same side, so let's just make sure that we are. Which we are. Some extra fibers on this thing. Like I said, this is microsurgery and music. I think they're a great combination. You're going to hear my questionable taste. Okay, I'm going to talk over any bad language because that's not necessary. All right, so in microsurgery, you never want to cross your hands. So some people air tie. I don't have any fancy tricks for you. So needle holder is in my right, the dilator is in my left. I'm going to use them interchangeably. What that means is that the instrument that's going to bring the short suture to the opposite side, so this short suture needs to come over here, is the one you're going to wrap around. So to start with, it's going to be like normal. The tips of the needle holder can be up or down. I'm going to have them down because my suture is down there. 1, 2, rotating it, take it, pull it through. I can't quite get enough tension on it, so I'm going to bring it closer. And there we are. And then I'm going to pass this over to this side. 1 revolution, which is a reef knot. I'm going to let go, come a bit closer. Pulling just the long end first, so it retensions it, and now I'm putting the short on and I'm ready. Okay, and then interchangeably swapping. The tip of the needle holder being at the bottom makes my life a bit easier. I'm going to put the tension in the right area, which is here. I'm going to leave the short suture long and cut just the long one. Keep it short, and then I can use the short suture just to hold my vessel how I want it. Again, my field of vision is actually from here to here in this microscope. I could zoom in a bit more, but for me this is good. Haha. Again, if you want to get your own microsurgery instruments, you can. They're tagged in the stream. All right, so now we want to come a bit closer. So I'm going to go like this. I'm going to go in here. Because I can't do it in one, I'm going to just let go of it. And now I'm going to follow the curve and pull. Leave the short end a bit longer so I don't pull it out. And now I need to come out over here. You don't want any gubbins to go inside your lumen, so try not to let anything get caught inside. So now I need to go from inside and out. So I'm putting the dilator inside, retracting the wall, and I push. Counter traction, let go so I don't rip the vessel wall. Irradiated vessels, so patients that maybe have had radiation to their chest for breast cancer, will have fibrotic vessels. What this means is that you have to be a bit more delicate than normal, even more so, because if you don't follow the curve of the needle, you just pull, you're more likely to tear the vessel. Right, so we're through both sides now. That's the one from before, that's the one we want now. Put it somewhere where it's easy to access, or you can tell. So I'm leaving it slightly longer. I'll shorten it as I tighten it. I think one of the areas that people get caught in a tangle is that the long end of the suture needs to be out of the way. So it's down here. I wrap between the long and the short. 1, 2, 1, 2, and then I bring the, bring the suture backwards a little bit to keep it on the forceps. Taking it through, bring my needle holder closer and tighten. Just like that. This is a 9-0, so it's reasonably fragile. But that's why you have to have good theatre quality instruments to practice with. And that's what we've got here. My forearms are planted on the table to keep me reasonably static. Rather than pulling down here and putting the tension this over here, I'm letting go and I'm pulling over here. This one's a bit long, but I can now use it to turn my vessel if so needed. So I'm going to leave it a little bit longer. You would have clamps on. Some people use single, some people use double. The benefit of using a double clamp is that you can just flip the clamp to get to the back wall. But in simulation, you should do things the hard way. So that's what we're doing. Let's get this in the right position. Probably get away with using an ATO on this, but again, let's do the hard thing. So I'm inside the lumen. I want to come on the back wall, which is here, because otherwise I'll get a gap. I can't get it accurately across in one from what I can see. So I'm going to do it in two. Even though the temptation is high, I'm not going to give in. I want precision. Haha, now let's do this. Follow the curve and pull. Okay. And then we're going to do the matching spot opposite. No, that wasn't quite right. So if I go in the middle here, I'll get caught in a knot. I'm going to retract that out of the way. And I'm going to follow the curve, which is this way. I'm going to pull. All right, and put this, so I'd park this inside a structure, so I'd have it somewhere secure. And then we go 1, 2. Pull it through. Now my needle hole is going out of field. I'm going to come a bit closer, so the tension's in the right place. It's not, but that's okay. Keep grabbing the same thing over and over. So we're just gonna work with what we've got. And that's why I park my suture. Tighten that. Get that stitch out the way. This would be a great time to have an assistant, but I'm fresh out. So we'll see how I'm gonna lock that knot so it doesn't slip over so easily. I'm gonna hold this in the more favorable position as we sweat and do this very short suture. So close. Got it. Flick that loop out and then tighten that. Okay. So that's locked now, so one can relax a little bit. Again, it would be good to have an assistant, but I don't have one, so. Okay, what we're going to do is we're going to switch instruments. Because this one's a bit finer. There we go. that out. All right. So that was a tricky one. But we persevere. So you can get your Microsurgery Instruments at medsync.com/medshop. We want to clear some of these smaller sutures and try not to get into that position again. You can get your heparinized saline and flush your vessel. I'm just seeing if I've got an example for you, which I do. You can also get a background in there. So the way this would work is, because everything gets a bit dry and crispy, you get a lacrimal cannula or a pediatric cannula. You put it inside and then you flush to keep everything moist so that when you're putting your suture through, you don't cause problems. That was suture that it do require. So let's just tidy up all this excess fibers, like so. Okay. So yes, you would use a pediatric cannula like this, or a lacrimal cannula, and flush, 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 flush. Keep everything nice and moist, and then you continue. So we've still got some way to go. We still need to go all the way around there, but so far we're okay on the far side, which I would argue is the harder side. As I get closer towards me, it should get easier. But I'm not going to get tempted to go kind of straight here. I need to go somewhere over here because I'm using 9-0. I would rather not have any gaps, but it gets a bit easier. Keeping my elbows on the table, push through, put it through, and then remount it. Go here. I don't really like that bite, so I'm going to go a bit further back and then follow the curve. Pull, pull, pull. Notice I'm pulling in the axis of the vessel, not up in the air, because I don't want it to rip out. And again, let's hold it slightly closer and avoid, and keep the end short so it's easier to grab. That loosened, so what we're going to do is lock that knot, because we don't want that to happen. It's like normal suturing, you can slide a knot to one side or you can do a slip knot, but you need these things to be secure. So I'd rather just lock it and slide it to one side than do a slip knot. Or you can do 2 surgeon's knot, which is the 2 revolutions around this. So do 1, 2, tie it, and then do another 1, 2, and tie it, and it's locked straight away. And then we do 1 more reef knot. You can see that it's fractured there, so I'm going to hold it slightly proximal to that. I don't think I need that one to be long, so I'm going to cut this one a bit shorter, as I've got my back wall ones to turn it with. You can easily do this with chicken vessels to make it a bit more wet lab feels, but this is my dry lab option from medsyncltd.com/medshop, and it simulates microsurgical anastomosis rather than macrosurgery anastomosis. All right, so now we're on the home stretch. I'll probably do this in 1. Now I'm anterior. So I can see the tip of my needle here. I'm going to put it through. Always see the tip before you push it all the way across. I'm going to push it through again. I want it to be on a curve, so I've turned my needle holder sideways. I'm going to follow the curve of the circle up. so that I don't rip through the tissues. And it should, all being well, get easier to do because I'm more on the anterior surface and stitching towards myself. 1, 2. And you want to lift up as you tie, and then tie. Grab the tip of the short end. Lift up as you tie. Boom. So, like I say, the far wall and the back wall are the hardest parts to do. After those, it gets a bit easier. I try to grab the needle as few times as possible when remounting it. I think it's less damaging. These 9-0s, they break really easily, in my experience. Or they straighten really easily, so you know if you're putting too much tension through them. Again, I'm going in 1. I can see the tip. I can see I'm not catching the back wall. Pull, keep the short one short because it's easier view here. I turn my needle holder sideways so that it's a more advantageous grab of the long end. I pull it towards me and I make a curl, I make a circle here. Keep this a bit more horizontal than normal so the suture stays on it rather than slipping off. And grab that. Lift up and tie. Tips are still down. And pull the short one first to retension it and then tie. I like it a lot. Coming closer. And again, the music is just keeping everything nice and chilled. But sometimes, you listen to something fast-paced because you think you can do it with a bit of speed. Shall we zoom in and give you a closer view? So now, I think what the best thing to do would be is to flip it around. So I'm going to go under and take one of those sutures, and I'm going to try and pull it. So it needs to make sure that I need to make sure that my previous knots are nice and secure. Going to be tricky again. Let's see what we can do with that. So you want your knots to be outside, so we're going to go from outside to in on this side. I'm sitting here. Outside to in on this side, inside to out on the other side. I'm going to lift this up. I can see my lumen. Make sure I don't catch my back wall, or my front wall in this case. I'm going to let go now. I did not catch anything, and I'm happy with that. And now I need to go from inside to out. But my stitch came out. Catastrophic. It's fine, we'll do that one later. Can see my back wall, not catching it. Going in there. I've let go. Now I'm going to pull it through. Alrighty. So now we need to orientate our short and our long end. Short end is here. Long end is here. I'm going to leave it longer because I need to redo a stitch on the opposite position of this one because it came out when I was holding it. So we're going to go 1, 2. Like so. One of the challenges with microsurgery is that if it's a breast reconstruction, for example, the lungs will be going up and down, up and down. You have fluid in the area, and in lower limb you might have an X fix in your way. So you want to make sure that your skill set is as robust as possible. That's what simulation is for, to make sure that you don't have to worry about the basics: placement, economy of movement, precision, accuracy, and techniques that you need to make yourself more economical. So as we get closer and narrow the gap between the sutures from the front and the back, you lose space in the lumen. So you have to decide when you're going to do your last stitch. I'm going to probably put one more in, and then I'm going to do 2 sutures after that, so 3 more in total. The importance of that is I can do a double suture for the last 2. I'm going to do the far side first, so the side closer to me, and then I do the double on the more anterior surface, because you want to make sure you're not capturing back wall. I can go forehand. Let go. So this is a challenge I'm setting for myself, really, to get better, more economical with my microsurgical skill. I don't like what I just did, so I'm not going to do that again. No, we're going to go over here. Because there's no advantage to grab on the simulated vessel, so I can't just pick it up here without crushing it. So I'm taking the suture, lifting up. It gives me the traction I need, the ability to see where I'm going. This is the suture we want. Don't get confused. The music is continuing. We like it. And tie. I'm going to lock that because it unraveled a bit. Pull, slide to one side. Just using the instruments interchangeably, so I don't cross my hands and I can see my point of tension at all times. My eyes barely leave the microscope. Cut, 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 cut. So now I'm going to do a double loop. I think I have enough suture to do that, so I'm going to do that now. Let's make sure you can see. So you're going to do a double. Pay attention. So you can either, well, double just means I'm going to do 2 in a row, a continuous stitch essentially. Let's do the far one first. You see that I haven't caught the back wall. And so then rather than tying it now, I'm going to do another one, like a continuous stitch. Because if I tie it off, I won't be able to get into the lumen and pull out any debris or ensure I haven't caught the back wall. Yep, this is providing the counter traction and pushing down as I push the needle through. So you can either tie your knot now, or you can cut it in between. If I was tying the knot now, this would be my, let's get out of there. If I was tying it now, I would tie like this and pull the loop through. But because my stitch material is a bit short, I'm going to give myself more for this bit by doing this. It's still risky, but I think it's going to be a bit easier for me with regard to that. Just can't afford to put it too much. Let's narrow that a bit. 1, 2. Pull up and tighten. You can see how fine this suture is, although it's a 9-0. It's a really, really fine suture. So the needle holder is able to grab it, which is why we say that our needle holders and micro instruments are theatre quality, because you can do the finest of work with them. I'm using the dilator and the needle holder to do all of this. Now I'm going to use the needle to help me tie. Gives me a bit more length and flexibility. 1, 2. I don't let the instrument open all the way. I, in a controlled fashion, open it. So I don't go like that. I just let it open a little bit. But I want my needle holder to be upside down so it's easier to grab this. So 1. Let's fix this a little bit. Tricky, tricky, tricky. I'm gonna put it up again actually. Pull the short one first because it's a bit loose. It's tight now, so I'm going to pull the short one, the other one as well, the needle end. I like it a lot. My suture has gone south. Before I tighten that, flick that out. And one more. Tricky, 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 but we're still good. Let's bring that suture on top. Okay. Might switch instruments in a second. Try one more time. Pull that through. Pull the short one. Okay. Good. Cut this. At this point, you'd have clamps either side. Before you lose your needle, park it. What does that mean? Hold on to it. Bring your suture park back into the field and put it in. I'm going to take the other one that I have in this pack out because I think it's a 10 this. No, it's a 9. But I need to do another one in the back also. I'm going to pop that in there temporarily. Get some Hepsal, flush the field, keep everything nice and moist. But remember when I pulled the suture at the beginning, one came out. So this is how I turn it. I'm going to place a suture here. I hope, to try and replace that one that came out because that's a gap. Tricky stuff. If you have done it with a double-ended, you will fare better. If you do it with a double clamp, you'll fare better because you just turn the clamp over. But I didn't do that, did I? But it's not very good, so I'm going to try and reverse it a little bit. Notice how my suture, I'm pulling it away. It's my counter traction suture. Okay. And then we pull. Great, 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 great. I need to figure out which suture is which. I think this is my counter traction suture. So I need to tie with that one. It says, let's see. Yeah. No, I'm holding the one I have to tie with. Okay. So it's this one here. So let's tie. 1, 2. That one there. Keep it a bit long because we're on the back. We don't want to get confused. We don't want to lose it. A lot of music going on. Home stretch. Some uplifting beats. Pull the short one to tension a little bit and then pull the long. Happy with that. Feels like it's reached an end point. Okay. And now we can put our needle back in the park. Oh, no, we can't because we haven't cut the needle end. Wild. All right. Let's put that back in the park. And then I guess we make our assessment of this anastomosis. So I would say they are evenly spaced. There's a small gap just here, but I'd probably take the risk and see if it would actually bleed from it, but I think that gap would need to be addressed. It's a bit uneven there. So a small gap to the back wall, I'd say, is a bit that little gap at the bottom there. Now the apex probably could do with addressing. But I take off the clamp. You take off the clamp on the outflow first. So let's say the vessels are flowing this way. Take off this one. So you test with backflow from neighboring connections. So backflow first. So take off the distal clamp first. It's under lower pressure. If it oozes a little bit, you can put a stitch in it without too much disturbance to your surgical field. And then you take out the inflow clamp. It'll be under higher pressure, so it really tests your anastomosis. And that is day one of our micro challenge. See you later. Get your instruments and your micro set from medsyncltd.com/medshop tagged in the stream. Take care.